Well, October is Breast Cancer Awareness Month. So every year we like to talk about the importance of screenings and early detection. And sadly, 1 in 8 women will develop the disease in her lifetime, according to experts. And in a man's lifetime, the number is 1 in 833.
Exactly. So we've had some, I call breakthroughs and new treatments over the last 12 months since last October when we did this. In addition to mammograms, doctors are crediting ultrasounds with helping them treat patients. But do you need to ask your doctor to perform like an ultrasound after your mammogram, especially if you're told you have dense breasts, which is a reflection of the amount of fibroids and glandular tissue seen on the mammogram?
So I want to bring in Dr. Ryan Brannon, who is an OBGYN at Jefferson University Hospital. And you're here to tell us what's new, what we need to be thinking about when it comes to breast cancer.
Before we get started, though, you may have talked about this. We've had people in talking about what a dense breast is. What is that? It has nothing to do with the size of the person.
No, not at all. The breast is made up of 3 primary types of tissue: fibrous tissue, glandular tissue, and then fatty tissue. The more fatty tissue you have in your breast, the less dense it is.
Oh.
Right, so the more glandular tissue, which is the tissue that usually produces milk after pregnancy.
Okay.
And then fibrous tissue, the more of that kind of tissue you have, the denser the breast is.
But by self-exam, you can't tell if you have a dense breast.
I think most physicians have an idea if you have a dense breast.
A physician does, but what
has an idea, you know, but it's not absolute. When they go and they have the mammogram, you'll get a better idea of how dense a patient's breast. Yeah.
How important is it to know that? Because I was thinking, I don't know if mine are. I mean, is that something every woman should know at a certain point?
I think when you start getting screenings for breast cancer with mammograms and such, they'll be able to tell.
Okay. And when's the age to start?
Well, there's a lot of different recommendations that exist.
Yes, because there are young women who get it too.
American College of Obstetricians and Gynecologists, American Cancer Society, United States Preventative Task Force, they all have different recommendations. I would say that they range anywhere from 40 to 50 years old, but I think what's consistent is that at around age 40, you should start having that discussion with your physician.
Okay.
But even though sometimes when you go to the doctor or when you go to the OBGYN, they will still at least do a test. It may not be the full mammogram, but they'll...
Well, they'll do a breast exam.
Okay.
And then recommend sending you for screening testing.
Okay.
Would it be harmful to start at 30 or 25?
Well, the rate of cancer in women of that age is so low. You're not really gaining anything.
But if you have a history in your family,
if you do have a history in your family, so if you have first-degree relatives who were diagnosed at a very early age, then there may be some benefit for you being tested at an earlier age as well.
Okay.
So let me get this straight. If a doctor says, okay, you have dense breasts, is that a good or a bad thing? Do you have better odds if it's dense or not?
Better odds of
not getting cancer?
Well, I think what it is the ability of the screening test to detect the cancer goes down with denser breasts. The mammogram's not as sensitive, so they've established kind of new testing, ultrasound, MRIs, to help the radiologist see smaller masses if you have denser breasts.
So that's why you would have an ultrasound even though you had the mammogram.
Right. The mammogram's a great first screening test. Don't get me wrong. That's a great screening test. But when the breasts are dense, sometimes those masses are obscured by some of that density.
Would the doctors, when you go in to get your mammogram, would they suggest that on their own? Is that something you should try to request? Saying, hey, I know that I have this. Is there a way I can also get an ultrasound?
So it's interesting. I think most radiologists or most sites, if you have a mammogram and they're dense breast, they'll ask the physician, your gynecologist or primary care doctor, to order additional tests. Some women, they've had that experience in the past. So some of my patients will ask, hey, doctor, can you order me the mammogram and an ultrasound because I get that every year?
I'll be darned.
And then how does this differ when it comes to men? What point do they also do an exam, or how would you be aware to make sure that you're on top of it if you're a man?
Right. Well, like you mentioned earlier, the rates for men are so incredibly low. It's only about 1% of all breast cancer diagnoses are men. So it's not quite the same. Men don't have, annual screenings. That they're not recommended. But if, as a man, if you do feel a mass or something, you should get it checked out.
What was this deal not long ago? People being nervous about getting a mammogram.
Well, I think
It can be uncomfortable.
right.
Yeah, it's
We wanna promote it.
painful,
Uncomfortable.
Uncomfortable. More.
Right.
uncomfortable.
And I think that for many patients who haven't gone through it before, they may have heard stories from family members, friends, cousins, aunties, that it wasn't as comfortable as they would have liked. So sometimes there's some hesitancy there. But I think once they go, they have that experience. Plus, again, there's more technology now where we can do ultrasounds and MRIs to help help.
Okay, that was good info.
Yes, very good.
Nicely done.
Thank you.
Well, thank you.
All right.